Why is lung anatomy important for understanding cancer spread? Imagine the lungs as a complex network of highways and neighborhoods, each with its own role in how diseases like cancer move through the body. Understanding this intricate structure is key to grasping how lung cancer can spread beyond its original site. The lungs are made up of airways called bronchi and smaller branches called bronchioles, which carry air deep into the lungs. These airways are surrounded by blood vessels and lymphatic vessels, which are like highways for cells and fluids. When lung cancer develops, it can invade nearby tissues directly, growing into the lining of the lungs or into neighboring lobes. But it can also use the lymphatic system, tiny vessels that drain fluid and immune cells, to travel to nearby lymph nodes, especially those around the bronchi and in the central chest area called the mediastinum. This is often an early step in cancer spreading within the chest. The location of lymph nodes in the lungs is very important. These nodes act like checkpoints, and when cancer spreads to them, it usually indicates a more advanced stage. Knowing which lymph nodes are affected helps doctors determine how far the cancer has spread and guides treatment decisions. For example, if cancer reaches the mediastinal lymph nodes, it may require more aggressive therapy. The anatomy of these nodes and their connection to the lungs helps in staging the disease accurately. Another aspect to consider is the lung microenvironment, the local tissue surroundings including alveolar cells and immune cells. This environment can influence whether cancer cells survive and grow after spreading. Certain signals in the lung tissue can promote the growth of metastatic cancer cells, creating a favorable soil for the seeds of cancer to take root. This process explains why some cancers tend to spread to the lungs and then further invade other organs. The anatomy of the lungs also explains why lung cancer often metastasizes to organs with rich blood supplies like the liver, bones, and brain. Cancer cells can enter the blood vessels in the lungs and travel through the bloodstream to distant sites. Specific molecules on the surface of cancer cells help them stick to tissues in these organs, facilitating invasion and growth. This organ-specific spread is influenced by the anatomy and cellular environment of both the lungs and the target organs. Clinically, understanding lung anatomy helps in diagnosing and treating cancer. Imaging techniques like CT scans and MRIs relying on knowledge of lung structures to locate tumors and assess spread. Surgeons use this information to plan operations, ensuring they remove all affected tissue and lymph nodes. Knowing the pathways cancer cells take allows doctors to monitor for metastasis and choose the most effective systemic therapies. In summary, the detailed structure of the lungs, the airways, blood vessels, lymphatic system, and surrounding tissues forms the physical and biological framework that guides how lung cancer grows and spreads. Recognizing these pathways helps in accurate diagnosis, staging, and treatment planning, ultimately improving patient outcomes. Always consult healthcare professionals for personalized advice, but understanding lung anatomy is a vital piece of the puzzle in fighting lung cancer.